Hello, my name is Joyce Stratton, and I am taking a comprehensive head-to-toe assessment, final assessment for Nursing 650, and I'm consenting to this video. Nancy Matthews, are you consenting to this video?
I do.
All right, sounds good. We're going to do a 360 as you requested, and then from there we'll continue. We'll start with the assessments. So Ms. Nancy will help us with the 360, just to make sure nothing is there. As she's doing the 360, I just want to note that we've done the vital signs and all the vitals are stable. She is not in any pain. She is not in any distress. She is calm, and as you said, she's consented to doing this video, and she's oriented to 4. So I'm going to have Miss Nancy go ahead and have a seat. All right, I'm just going to do a physical skin assessment first of all, checking at the moisture. She's not sweaty. She is nicely moisturized. There's no tears, there's no ulcers, there's no skin tears, there's no lacerations in her skin, and then her skin is the same as her ethnicity. So we'll just go ahead and do like a quick assessment of her hair. As you can see, the hair strands are evenly distributed. We do not, it's very clean, it's thick hair. We don't have any needs or any infestations going on right there. So I'm going to go ahead and palpate as well. It's not saying having any pain. All right, there's no deformities, there's no swelling, there's no hair loss noted as well. So I'm going to look at her eyes. When I look at her eyes, I'm going to look at her eyebrows and her eyelashes. The hair is evenly distributed. And then her eyes are also symmetrical to her face. There's no swelling, there's no budging, there's no drainage, there's no ulceration noted. So I'm going to go ahead and I'm going to do, using a pen knife, using a pen light. I'm going to do a quick assessment on her. All right. I'm going to have you just look at me straight ahead. All right. Her eyes are reactive to light. All right. And then I'm going to have her just look straight. And then look back. I'm going to have her look up. Look down. Like that. And then follow with your hand. Okay. I'm going to have you just, without turning your head, I'm going to just look at the side. If you can just turn your eyes only towards the side of my pen light. All right, there's no nystagmus noted, and I'm going to do the same with this one. If you can just turn, there's no nystagmus either. I'm going to have you close your eyes and then open them. There's no eye lag as well, so we're having, the eyes are good, and we have Perla. When I'm doing the Perla, is also the second cranial nerve assessment as well. So when we do the cranial nerve, I will bypass that because the other alternative is to use the chart, but we don't have the chart because we are not supposed to have any papers around here. The next thing I'm going to look at is I'm going to look at her nose. As you look at her nose, just there's no drainage noted, there's no rhinitis, I'm not seeing any swelling, I'm not seeing any problems. I'm going to have her just go ahead and touch and take a nice deep breath. All right, I'm going to do the same on the opposite direction. There's no blockage noted, and also when she's touching, I'm not seeing any septum deviation. So there's no, it's asymmetrical, and also towards, it's asymmetrical along with the face. So also what I'm going to do using the pen light, I'm going to go ahead and have her lift up her face. I am not seeing any drainage, I am not seeing any swelling, I am not seeing any ulceration. There's a little bit of hair evenly distributed, the nose is clean, we're not having any ulcers as well. So, and then while we're there, I'm just gonna have you, I'm gonna go ahead and look at the lips. The lips are pink, they're moisturized, it's not dry, there's no ulcers, there's no herpes type A, we don't have type 1, we're not having any problems with the skin around the lips. So I'm gonna go ahead and have her stick out her tongue for me. If she sticks out her tongue, just swing it side to side. And also this is also a cranial nerve assessment as well. And then I'm gonna have you just go ahead and stick it out. I'm gonna look into the mouth. In the mouth, I'm looking at the uvula, its midsection, and then I see the soft palate. And then we see, I'm looking at the gums as well. The gums are clean, there's no ulceration, there's no bleeding. And then I'm gonna look at the teeth. We don't have any dental caries as well. So I'm gonna have her just, let me see the teeth, and then while doing that, okay, again, as I say, the gums are clean, there's no ulceration, there's no bleeding noted. And the mouth, of course, is also very, very clean. So the next thing I'm gonna look at is I'm gonna go ahead and look at the ears. The ears from this angle, there's no deformity, there's no tophi. You're not having any problems with the skin, there's no drainage. If I touch on them, are you having any pain? All right, there's no tenderness, there's no pain as well. Okay, and then what I'm gonna do, I'm gonna look at the neck as well. So from the neck side, I'm gonna just look at the symmetry. We're looking at the thyroid region and the trachea region as well. It looks very symmetrical. There's no swelling noted. If I put my finger against it, it's evenly placed. I don't see any swelling noted as well. If I can have you go ahead and swallow for me. All right, if you see the dropping of the trachea, the dropping of the thyroid part, it's also very even. I don't see any swelling noted. Well, I'm still here. I'm gonna do the lymph nodes. I'm gonna do the lymph nodes from the preauricular all the way to the bottom. So if you can bear with me, I hope you can hear me when I'm touching. And then, are you having any swelling? Are you feeling any pain? I don't feel any swelling. I don't feel any problems with it. And I'm just in the front, and I'm on the postauricular part. No swelling noted or felt as well. And then I'm going to be right behind on the accipital side. And again, no swelling. The lymph node looks good. Submandibular and mandibular levels. There's again no swelling noted as well. And I'm going right down the neck side. No swelling noted as well. And then right here on the subclavicular and the subclavicular side. No swelling noted, no lymph nodes, no lymphadenopathy, no swelling noted on the neck. So while I'm still in the face area, I'm just gonna go ahead and do, we already did the second one, the oculomotor with the parla. So I'm gonna go ahead and do the rest of the cranial nerves assessment. And so I'm gonna go ahead and have you close your eyes. And then with, just close one of your nails, one of your nose side, and then I'm gonna have you tell me, can you smell anything? What is this? Perfume? And let's do on the other side with your eyes closed. All right. So that's the first one, and that's olfactory. You can smell the perfume. And then the second one, as I said, we've already done it. I'm gonna have you, just before, I'm gonna go back to the nose. I just remembered right now something quick I forgot. I'm gonna do the sinuses. Well, I'm at the nose. So I'm gonna do right the occipital sinus, and then are you having any pain? And the frontal sinuses as well. Okay. All right, so as I said, we just did the first one. The second one is a parla. The third one, I'm gonna have you, I'm also gonna have you just, third, fourth, and sixth, I'm gonna have you just bite down and open wide. Open your mouth wide, okay. The 3, 4, and 6. All right, go ahead. And then try and push, open your mouth for me. Okay, go ahead and close. There's a little bit of pressure of resistance as well, so that's good. I'm gonna also have her stick out her tongue for me one more time, and then swing it side to side, and then go ahead and swallow. That's good. And then I'm gonna have you turn your head side to side, and then I'm gonna have you turn it down on your neck. All right, in the opposite direction. I'm gonna have you shrug. Very good. I'm also gonna have you puff your mouth, like puff your cheeks for me. Try and resist them. Very good. And then I'm gonna have you close your eyes real tight. Try and resist me from opening. All right, very good. So we've done the cranial assessment as well. So then I'll come to the respiratory side. The respiratory side is just her breathing. I'm gonna assess her. There's no use of accessory muscles. She doesn't look like she's labored. I'm not getting any adventitious sounds even without auscultating. I see that she's breathing okay. Her AP diameter, A to P diameter is 2 to 1, so we don't have any problem with something like COPD as well. And then from then I'm gonna ask, are you having any trouble breathing? Do you have any shortness of breath when you move around or anything like that? Any pain with your? Okay, so no signs of pleural effusions, something experienced this week. So The next thing I'm gonna do is so that I don't forget, I want to do the quick assessment on both the front and the back. In this photo here. Let's have it all the time. Oh, 10 minutes. 10 minutes. Okay. All right. In this part, I'm gonna go ahead and I'm just gonna press on it. And in this pressure, when I'm pressing, just say 99. All right, go ahead. 99. Oh, just remove this. Okay. Go ahead.
99. 99.
All right.
99. 99.
And then I'm gonna say move this in.
99. 99. 99. 99.
And what I'm gonna do is I'm actually gonna smack on it. And I'm just gonna cuss it. You just take a nice deep breath. Anything is take a nice deep breath. In and out. Yes. In and out. And say 99.
99. 99. 99. 99. 99.
Right, so that's the lamp. We've inspected. There's no adventitious sounds heard as well. There's no labored breathing, no use of accessory muscles. The breathing is, her lung sounds are all clear at all bases. And then I will, if I may, I'm gonna have you later. All right, in this case, I'm gonna do a cardiac assessment. Have you been having any shortness of breath? Any rapid heart sounds? Okay. All right, so in the same token, I hope you can hear me from here. I'm just gonna go ahead and I'm gonna start with the aortic, which is on the right. Go ahead and have, okay, I'm just gonna listen. I'm listening for any bruit, and there's none. And now on the pulmonic, no bruit as well. In the abs point, there's no valve here, of course. And then we go to the mitral. And then to the tricuspid and mitral. Also, this is also the PMI assessment where I'll assess her heart sounds for about a minute. 74 beats, which is normal because it should be between 60 to 100. All right, and then now we're going to do an abdominal assessment. If it makes you stand, expose your abdomen. And at the beginning, I did a hand washing. I forgot to mention that. We did the hand washing and we're ready, but we have some set of gloves, but I don't need them. She's okay with me just using my bare hands. All right, just for the skin assessment, I'm just going to look at her abdomen. There's no irregularity. It's not asymmetrical. It's symmetrical. There's no stripe. There's no lacerations. There's no cuts. The stomach raises and descends appropriately. And then actually, if you look, I know you might not be able to see from this angle. Right above where the aortic, you can see a little bit of attrition going on. So in this case, I'm going to go ahead and I'm going to, this is the only place where we auscultate before we do anything in terms of like percussion. So from the umbilical, I'm going to go ahead and above. I'm going to listen to it. That's the aortic. Okay. And then from this point, this is the renal. And the renal as well. And then a little lower, we'll go to the femoral. So no buoy, no sounds felt, and I'll do the same with the bell. So there again, this way. Just go. Again, there's no bruit, no sounds felt. It just, and again, as I said, no swelling has been noted. So the next step I'm going to do, I'm going to go ahead and percuss. So using both hands. Let's go ahead. All right. Go ahead and press. And in this case, no masses, no swelling, no guarding. Are you having any pain on the cushion? Okay. So for the abdomen assessment, it's symmetrical. There's no skin tears, no problems. And then we have a tympanic sound when we percuss. And then of course with the pressing, we have no masses, no guarding, no pain, no swelling. So, first now we'll have us stand up a little bit. And then now we're going to do, go ahead and have a seat and then go ahead and stand up with your eyes closed. Sorry. We're going to start the muscular assessment. All right, and go ahead and have a seat again. We'll have your with your eyes closed and your arms out, extended out and palms up. Go ahead and stand up. And then, with the hands the same. So go ahead and sit, and then when you stand up, you stand with both. I'm sorry. Yeah, go ahead. Go ahead and stand up. There you go. And this we are just assessing for the gait as well. And then go ahead and have a seat one more time. And then go ahead and relax. All right, I'm gonna have you lift up your arms. Open your hands, lift up your arms like I'm doing. Drop them down. I'm gonna have you lift up your arms again, and this is just to assess further drop. Just go ahead and relax. No arm is dropping, they're just relaxing distantly. I'm gonna have you stretch out your arms forward, relax. I'm gonna have you stretch your arms backward the same way. And relax. Go ahead and relax. I'm gonna have you use one of your arms and touch the back. And then go ahead and relax. I'm gonna do the same with the other arm, if you can just do the same. And go ahead and relax. I'm gonna do the same I'm gonna do with your feet. I'm gonna have you swing your legs side to side and then apart and together. Alright, I'm gonna have you, I'm gonna press on it for support, for pressure. If you can just go against, lift up your legs, both of your legs together. Alright, and then I'm gonna have you press out, good. And then I'm gonna have you press in, very good. And then I'm gonna have you stretch out your legs. I'm gonna have you, yeah, yes. I'm gonna have you just go ahead and push up on your legs, on both of them. And both. Very good. All right, I'm gonna have you push against my fingers right here. No, this like you're lifting up. Yeah, like that. Go ahead. There you go. I'm gonna have you do the same. There you go. I'm gonna have you do the bottom ones as well. Push down like you're breaking. Very, very good. I'm gonna have you tap. Go ahead and tap on my, now you can see. Yeah. Go ahead and the other side. And that reminds me, I need to do that with the eyes as well. All right, I'm gonna do that with the fingers. If you can go ahead and tap. And then go ahead with each and every one of them. All right. And then I'm gonna have you look forward, straight ahead. And then I'm gonna have you just, let me know if you can see fingers rising and when they rise.
It's
No?
not.
Okay.
No,
Okay.
no,
Okay.
no.
All right. And then I'm gonna have you, that's the leg one, and then the arms, okay. Now I'm gonna have you put as an elbow, just like that. And then I'm gonna have you push against me. And then I'm gonna have push this way. All right, push up. All right, and push down. Okay, that's very, very good. And then I'm gonna have you just spread out your fingers. Completely spread them out. Try to fight me as I try. There, very good. Very, very good. I'm gonna have you pull up like this. Okay. All right. That's just for checking for carpal tunnel syndrome as well. And that was the legs. All right. And then I'm gonna have you do something real quick. While I'm still, before we sit down one more time for another assessment. And I'm just gonna check on the time. 22 minutes. I'm gonna have you close your eyes and spread up, open up your palms up. I'm gonna put a few things in your palm, and then you tell me without opening your eyes what you see or feel.
Ring.
Okay, that is a ring. I'm gonna give you another one right here.
Coin.
Okay, that is a coin. Last but not least, I'm gonna give you one more. That is a sift pin. I also want you to let me know if I'm touching you with one or with 2 pointers, okay?
2, 1, 2, 1.
Okay, I'm also gonna just draw something. You tell me what you think I'm drawing, okay?
1,
Okay.
1, 2, 2.
Alright, that sounds good. And then that should be good. Alright, and then what I'll do is I'll just check your, when I'm still assessing for your, I'm gonna check your brachial pulses. They are normal at about 2. They're not thready. And then the brachial pulse as well. Sorry. The same, they are normal, is a 2. I'm gonna go ahead and check your carotid. You can just look straight ahead. All right, just go ahead and take a deep breath and then hold. Okay. All right, this is the only part where you just do an assessment on one side each. All right, one more time, go ahead and take a deep breath and hold. All right, okay. And then I'm just gonna listen to the carotid as well. And it's gonna be cold. Just go ahead and take a nice deep breath and hold. Alright, keep it out. And then let's do it one more time. Alright. I'm gonna do this on this side. Take a deep breath and then hold. Relax. All right, now in the assessment, there's no droid. There's nothing that's making a lot of whooshing sounds, so that's normal as well. So I'm gonna have you stand up for me. I'm gonna have you walk back and forth. All right, and then I'm gonna have you walk back. All right, I'm gonna have you walk on your toes as well. Perfect. All right, and back. All right, I'm gonna have you now go ahead and lay down. You have 4 minutes. Okay. All right. I'm gonna have you just go ahead and lift up your leg at a 90-degree angle, like folds at the knee. Very good. Do the same with the opposite. All right, very good. I'm gonna have you spread your legs apart and bring them back together. Very good. I'm gonna have you lift up your body like your head. Okay, that's just a quick assessment. You're not raising this part, so that's very, very good. And while you're laying down, I'm just checking for the JVD. Any jugular vein distension, and there is none whatsoever. So we don't have any heart failure situation going on for her. And then while she's laying down, actually, I'm gonna do a couple of last final things. I'm gonna listen to the spleen and the liver. So hold hands, spleen. I don't feel any friction wraps. And then the liver, the same, no friction rubs either. And then, of course, you can feel there's no swelling around the sides. I'm gonna have you go ahead and have a seat. And I'm gonna listen to your back as well. For the kidneys, okay, any pain when I press on it? All right, there's no pain on the back. And then I'm gonna have you stand up one last time. I'm gonna have you look away from me. I'm looking at the spinous process. There's no swelling. There's no deformation. I don't see any tears. If you bent a little bit for me, and then bent back, bent all the way back forward. All right, bent back, backwards. All right, swing side to side. All right, the spinal process is appropriate. And that being said, we are all done. Thank you very much. Have a good day. Bye now.